Technology was once again at the front and center of the recent ADA meetings. Now, I'm not going to go through all of the details of all that was presented, but I think we should all be proud as part of the diabetes community in terms of where we've come and where we're going, because our ability to use technology and help our patients has really made a difference. And in many, many studies that were presented, and many of them were all sorts of real world data with all sorts of different automated insulin delivery systems and such, we really saw improvements in outcomes. And I think this just further cements our recommendations that these kind of tools should be used in people with type 1 diabetes and insulin requiring type 2 diabetes. My sadness to much of this is the difficulty in getting some of these devices for under-resourced patients, and the fact that to some degree technology does worsen some of the divide between those who are well-served and those who are underserved. But I know these tools can be used to help everybody. And I think that regardless of socioeconomic status, we can use these, but we need to be sure to use them in the appropriate context with the appropriate support. Suffice it to say that almost any system you want to look up was discussed, and pretty much all systems provide benefit in our patients with diabetes. And it's true for patients with type 2 diabetes who are and aren't on insulin, as well as people who take insulin. There were even interesting abstracts about people who don't have diabetes yet, who have prediabetes, who are using the devices that they can get over the counter. So this is a field that's evolving, and each ADA, there are even more interesting bits of data that you can learn as you go through the meeting. In addition to data on AID systems, there was data on CGM use in a wide variety of different settings, which included people with type 2 diabetes who weren't on insulin, people with prediabetes, and even people using the over-the-counter systems. So we have a lot to learn from all the data that is being aggregated. And it just makes me happy because I've been such a fan of diabetes technology since it came on the market, and I think it's really spread out to help many people. The downside to this is that there are many, many people who don't have access to these expensive tools. And I think there's a lot of effort that's been made both by the ADA and others to expand access. So I think it's important that people recognize that we want to provide access to the tools that people need to appropriately manage their diabetes, no matter what their socioeconomic status. Now, in terms of one specific device I'm going to discuss the twist system. And the reason I'm discussing this is because it's just about to come on the market. And it's a pump that's actually a circle, and it's called twist because it twists. And it's different from other pump systems. It's designed by Dean Kamen, who is the man who designed the first Medtronic pumps. And it's got some interesting features. So first of all, it uses the loop algorithm. So this is the do-it-yourself algorithm that was developed a while ago that has many features, including the fact that it's got a lot of adjustability. So you can set varying targets. And I think it's a pretty good algorithm. I haven't used it with this pump yet, but my feeling is that embedded in the pump and used as an AID system, it's going to be very helpful. This pump also has this occlusion alert, so that if there's an occlusion to the insulin delivery, it's going to make a noise so that patients are alerted to this. Now, it worries me a little bit because I think patients get occlusions all the time, like they sit funny and the catheter kinks or something. But I think that for really bad occlusion issues where people's glucose levels start to go to the 300s and 400s and they have to do troubleshooting, that this might alert people in advance before they become very hyperglycemic so they can change out the infusion set. But I think it's an interesting concept, this occlusion alarm. I think it's interesting that this pump uses the loop algorithm, which is now FDA approved. It's a different pump in that it is physically different. It is a tethered pump, but I think that our patients are going to find this interesting, and we're going to need to see how they like it, because I can never tell for sure what I think about something until my patients tell me. It does work with the Freestyle Libre 3 Plus, and that's what it's going to be launched with in terms of the sensor. It will also work with the Eversense 1-year implantable sensor within the next several months. Eventually, it will also integrate with the Abbott dual glucose ketone sensor. So I think there's going to be a lot of interesting different ways in which to use this, and we'll see what patients think and how it works. They did present data from 2 trials, one a small investigator-led study, and one some real-world data, which showed that the pump was effective and there were improvements in time and range without a significant increase in time below range. So this sounds promising. I love having my patients have more options, and we'll see what happens as our patients begin to use it and give us feedback. This has been Dr. Ann Peters for Medscape.